This is the In Focus podcast from The Hindu.
Hello and welcome to another edition of the In Focus podcast. I'm your host G. Sampath. The World Health Organization (WHO) is the most influential body when it comes to setting the global agenda for public health. The forum through which its 194 member states discuss and decide on policy matters is known as the World Health Assembly. Now, every year, the World Health Assembly meets for a week in May. And this year's session, the 77th World Health Assembly, started on May 27th earlier this week and will conclude tomorrow on June 1st. Now, there's been a lot of interest in the WHO negotiations this year, as the agenda items include an ambitious pandemics treaty and also amendments to the international health regulations. So what has been the outcome of the talks so far? And what role can the World Health Assembly play in democratizing the policy setting space at the WHO? And where does the World Health Assembly figure in the WHO's evolving funding scenario, where it has to juggle pressures, which is well known, pressures from Big Pharma, while also staying true to its mission of health equity and social justice? We discuss all these issues and more in this episode of In Focus, and we have with us Professor T. Sundararaman, a public health expert who has served as Executive Director of National Health Systems Resource Center and as Dean and Professor at the School of Health System Studies at the Tata Institute of Social Sciences, Mumbai. Professor Sundararaman, thank you so much for joining us and welcome to In Focus.
Thank you.
So to start with, as I was saying in my intro, most people know about WHO, but not much is known about WHA to the lay audience. So for starters, can you just give us a quick overview, background on what exactly is the World Health Assembly and how important is its function vis-a-vis the World Health Organization?
The World Health Assembly is the most important institutional structure and, in fact, the decisive structure of the World Health Organization. It is an intergovernmental, democratically designed institution, unlike many other later institutions, where every member state is every member nation, has got 3 delegates and has an equal vote. And this meets once a year and has the entire powers to direct the executive board and the secretariat. So when we talk of WHO as an institution, very often we are referring to the secretariat. But the entire approval of policies, work plans, the selection of the Director General, the making of agreements and treaties are all done by the World Health Assembly. Obviously, they have developed a considerable number of protocols to make such a large body function well, and one of this is the functioning of the executive board that lays out the agenda. And this World Health Assembly has been very regular in its functioned even during the COVID-19 pandemic, and now we are on its 77th meeting. And now it's charged with some of the most important agenda items, even by its standards.
Right. So would you say that the World Health Assembly is, say, more democratic than the WTO, for instance?
Nominally, the WTO is also made up of every member having a vote. But there is a requirement that all members agree, and there are different ways in which it functions less. But we must compare it to things like the World Bank or, say, UNICEF or some of these organizations, which do not have, which are weighted in favor of countries with larger GDP, the financial institutions, which are very different in their, or institutions like the Global Fund against tuberculosis, malaria, which has different compositions. So as a global health institution, this is quite the most democratically constituted.
Right, and it's basically constituted of health ministers of different countries.
By the constitution, it has to be the representatives of the different countries. The member states send their chief delegate and 2 other delegates. They can have any number of advisors. They can send the minister. They may send some other, like now the secretary of India, the Union Health Secretary is representing us. That sort of thing can happen on it.
Right. Thank you, sir, for sort of explaining what exactly the WHO is. Now, this year's session, the 77th meeting of the World Health Assembly, which is going on tomorrow, I think is the last day. So, most of the work for this year is already over. Work is in the negotiations. So, what has been the primary agenda of this year's session, and what are the main sort of discussions, themes that have been going on this week?
So broadly, the WHO work is divided into four themes, which are also known as the four pillars. This is more recent; it's not been there always, and this is more decision of the current WHO in function. The first one of them is the pillar one, or bringing 1 billion more under universal health coverage. And this deals with the progress towards the goal of universal health coverage. Among its sub-themes, it has a number of disease control programs, largely of a technical nature, of what is the control strategy against non-communicable diseases, against neglected tropical diseases, against immunization, against tuberculosis, against maternal mortality and for child survival, against antimicrobial resistance, and against malaria. That's this year. There is progress report on the other aspects of that. So that's one major component which gets discussed. The other major component, and this has become the central piece of this year's WHO, is 1 billion more under emergency protection. And under this rubric, we have this discussion on the pandemic agreement. It's no longer referred to as the pandemic treaty. So it is the pandemic agreement and the amendments to the international health regulations. These are closely related topics. This is the one drawing fire. There has been discussions on the pandemic agreement ongoing for the last 3 years, and amendments for the same time. The executive board had a draft. It was supposed to be finalized. There were a number of meetings, but still what we have is a draft which has certain sections marked in green to show that there is agreement, certain sections marked in yellow to show that there is near agreement, and other sections which are marked where there is completely no agreement or even divergence and contestation. So both these are contested documents, though there is some hope that the IHR, the International Health Regulations, will get through. The third major area is on the social determinants part of it, on the whole issue of 1 more billion, under which you have social determinants, health promotion, climate change, economic and health, a number of things come. And the fourth is making WHO itself more effective, where you have a whole lot of secretarial stuff, but you also have the approval of its work plan and its funding.
Right.
So it's a very elaborate agenda. It's a very elaborate, very intensive agenda. They have extended the discussion by 2 hours on every day to be able to complete it. And yet it's as it goes, a very business-like and very demanding agenda.
Right. Thank you for outlining these four broad themes of the agendas in this year's session, sir. So I was just wondering, you spoke about the pandemic agreement and how there are some areas which are green, some which are red, and no agreement has been reached. So what are the broad battle lines or the fault lines which are the bones of contention in this pandemic agreement discussions? I mean, it's a very important subject for the world as such. What progress has been made, and what more remains to be done for this agreement to be inked?
In contrast to the international health regulations amendments, there is very little green in the pandemic treaty draft resolution. Much of it is yellow, showing near convergence, and a lot of it remains white, which shows there are divergences. The divergences are very critical, and there is a sharp divide between the high-income industrialized countries and the developing countries. And interestingly, the developing countries case is being championed by the coalition of 47 African countries, with the emerging economies being more a quieter thing, largely in support, but not so aggressively leading the polarization on this. So the big issues are this. There is the issue of what is called pathogen access and benefit sharing, which to unpack simply means that all countries and big pharma and pharmaceuticals want quick access to a virus or bacteria that is causing a pandemic or likely to cause a pandemic, so that the diagnostic tests and the medicines and the vaccines can be uh, developed. But developing countries which have the onus of sharing these pathogens demand that if we give to you the samples on which you develop the medicines, then we should get a fair share of the benefits because it's based upon the virus genome provided or the bacterial genome provided. And therefore, there should be a sharing of the medical products that emanate from it. This, the West seems to have been confident that it will manage to secure access without promising benefits, and it stuck here. The second big issue is the developing countries are asking for a waiver of the intellectual property rights of relevant products when a pandemic is declared. And I'd say that, if there is a breach of the WTO agreements at this time because of responding to pandemic, that should be all right. The developed countries are unwilling to concede this. There's also related support for technology transfer as an active process, whereas at best, West is willing to concede it as a voluntary process. And there is a question of tighter enforcements regarding the surveillance capacity of health system strengthening, which will mean that developing countries will have to prioritize surveillance over other aspects, which they may just not have the finances to do. Finally, there's the issue of financing, and one larger issue that perhaps we don't have the time to go into is the One Health issue. And for most of the developing countries, that is very premature to
What
get
is the
into it.
last issue, sir? I didn't quite catch that.
It's called One Health.
One Health.
It means that there is four relevant intergovernmental organizations. The ones that deal with human health is WHO, but there is a one, the World Organization of Animal Health, that deals with animal health and veterinary. There is one on plants and the Food and Agricultural Organization, and one on the environment and sustainability. So all these four dimensions have to be necessary. So health of human health cannot be guaranteed in the absence of looking at those other related aspects of nature. And there, what is being required of developing countries, if it is imposed as a binding commitment, most of them may be unable to provide. These is the points of commitment. So there's no commitment to finance the least developed countries to be able to do that. So in some sense, people are unwilling to get binding commitments to keeping if I may summarize it to the extent of caricature of it, the high income countries are wanting what they require to keep themselves safe, to get themselves an early warning and be able to respond. There is not enough concern about strengthening the ability of developing countries to respond to that pandemic. It's all about them giving information, sharing genomes, sharing surveillance, but not about being enabled to respond to it. And that's where the the battle lines are drawn on that. And this time, the developing countries are saying that unless there is a commitment to help us cope with the pandemic, we can't be just sharing with you the information that enables you to share, to benefit from this, but not us to have an equal share in the benefits. That's, I think, the big issue on that. And you see, the agreement has not only not been reached, there's a clear divide. Some of the countries would say that let us push through and get the agreement signed by tomorrow, meaning most of the debatable clauses will be left to a future committees to work on. Others are saying at least by the end of 2024. And yet others are saying it may take 2 to 3 years and we may never get it. And some of the basic things have to be restructured. And in fact, there are two resolutions. The Group of Africa has moved that, yes, we want these things, but we want it by 2024. But another set led by, I think, Australia, Brunei, and others are going to argue for a longer time period on that. And the US is at some point, it's either they get it everything the way they want it, or they may actually not stay on board. So they are pushing for much more. They have clearly said they are not going to create any new financing mechanism, but they are unwilling to share anything on the products. So that's a position that they
Well,
have.
where does India stand in this whole divide, sir?
So interestingly, the representative from India, the Union Secretary, is the person chairing Committee A, which is managing this. And he is moved, I think today, or was it yesterday, he is moved for a combined working group, which will try to look quickly and see whether they can finalize the amendments by tomorrow. So it is positioned itself in a mediating space. Uh, but it's not party to any of the resolutions that groups of member nations are moving, and it's not very clear. You see, India is in a situation where it has a considerable capacity to make its own vaccines, drugs, and respond. Okay. So in that sense, it has a certain desire to align itself with the big pharma and the corporate of the world. But on the other hand, its readiness and its ability to respond have also got challenges, and it also sees itself as part of the developing world. So there's a situation where on some things they champion it, but on most things they are not taking the lead on that. But broadly, they are with the developing world on requiring more concessions on these critical issues from the from the industry.
Right. Can you talk a little bit about the amendments to international health regulations? I mean, why are these amendments needed, and where do we stand again on the negotiations that are going on?
So, yeah, it's sort of difficult to understand where the amendments to the international health regulations differ from what is in the pandemic agreement. They seem to be so similar and overlapping. So it's not just the audience that is confused, it is even those who are working on it. But having said that, one of the things the international health regulations does is to take a decision on when you call it a public health emergency of international concern, when you call it a pandemic, what are the measures that must be imposed, what is the commitment of different nations to provide information to it. So, and then what is the way they will, what level of authority will they have over countries, and what level of support will they give. So in this area, a lot of things have got agreed. For example, the definition of a pandemic emergency as different from and more than a public health emergency of international concern is more or less finalized and agreed upon. New gradings of emergencies are agreed upon. New definitions of health products are agreed upon. Another very important agreement is that every country will be obliged to form a national international health regulation authority and a focal point with which the WHO will communicate. Sometimes it's very difficult for WHO to understand who is in. Very true in India, for example. Sometimes it's the Home Ministry, sometimes it is with the Health Ministry. So, in some sense, it requires a clear clarity on whom the link between the national and international. There are new provisions regarding communication, consultation, verification, and implementation and compliance committee. So, in all of these areas, there is a lot of good agreement and welcome steps. So there are two or three areas. One, there is an insistence on developing core capacities of the health systems, but there is no clarity on a dedicated financing mechanism. The US has clearly stated it will not support a new dedicated financing mechanism, which is under the WHO and not under the World Bank. But the draft resolution, even the compromise resolution as it calls for a financing mechanism under the WHO. And therefore, if the country cannot meet its core capacities to prepare and to protect, then at some point it should be supported to do that. And the second thing, which is the same problem in the pandemic treaty, overlaps that problem, is that health products this commits the WHO to ensure that there is equity in the distribution of health products. So Article 3 starts with highlighting equity and solidarity. It commits the WHO to actually ensuring that there is equity in the supply, which is not, it is completely under contestation. And it's not very clear if the developing world concedes it in IHR, what will happen to the pandemic agreement negotiation? And if they do not concede it here and they approve, get the WHO's role in distribution, what will happen to it? Therefore, the requirement for harmonization between these two uh, major policy developments, which have implications, and I must highlight this. The implication of this is not only in the area of pandemic management. The implication of this is a contestation of international property regime and the whole distribution of power under a neo-colonial authority, where these are the former colonial powers and the former colonized. There is a relationship in trade, commerce, and industry which is under contestation, which when these things are dedicated. So there is a whole lot of geopolitics at work over here, and that's why it has not been easy. But unlike the past, the African countries have not been pushovers. They have not. There is much greater awareness of what they will be signing away, and I think there is a considerable developing world solidarity that is ensuring that as of now, there has been no surrender as the way it was in, say, the Uruguay round discussions or other things earlier.
Right.
But we don't know. We don't know because
Right.
there is a whole lot of
Right. So you were speaking about this divide between the former colonial powers and the former colonies, and there is whole set of geopolitical contestations over these products and intellectual property rights which are at stake here. So in terms of the statutory power which the WHO has in terms of policy setting and so on, how does that measure up against the influence wielded over the WHO by powerful states such as the US, by Big Pharma and organizations like the Gates Foundation? There is always a balance of power going on here, isn't it?
Right. So the WHO constitutionally called upon every country which is a member has to generate and give the WHO a certain fund. And that fund that they give for WHO is its budget, which allows it an autonomy. The fund that each country gives is roughly proportional to its GDP. At one time, this pooled fund, or called the CES fund, was 70 to 80% of the funding, and WHO ran on that. Today, it is about 15% of the funding, meaning many of the large countries, especially the US, have not delivered on what is their dues. And this started in the late 80s and has been become chronic since. So the funding, the proportion of the budget that is conceded by the high-income countries against their commitment falls very short. This is now being made up by bilateral agreements with these developed world. So you have an agreement with US, you have an agreement with Norway, you have an agreement with
the WHO has bilateral agreements with countries
and philanthropic organizations. I think the second biggest funder currently is not a country in the bilaterals, is Gates Foundation. Okay. And you have various other corporate philanthropies also into the financing. And now in this current round, there's even a move to highlight that. So now each of this funding comes with specific negotiation on agenda items, other than the informal influence it wields. So therefore, the WHO's ability to prioritize what requires to be prioritized for fulfilling its mandate gets compromised by the nature of funding it has. And it also means informally there is a lot of dependence on making sure that the big powers are on board. So though formally you still need a negotiated solution, meaning you can't just vote them out. You have to, you can call for a vote, and then you can actually vote down the minority of countries which disagree. But then their countries and their national laws and their companies and their control over the finances have to be actually, that's the reality. And therefore, you need to negotiate till you get them on board. In that sense, they are still the powerful force. But WHO remains democratic, at least as a negotiating platform, and therefore the strengthening of the democratic voice is important. For example, by sheerly exposing how these treaties are unequal, we are able to, the developing world is able to get pressure to bear on the developed world to make concessions. They can't just pretend that they are doing this in the general good. Their pharmaceutical, the interests of the corporate, the interests of their industry is well uh, made visible. They defend their interests by saying that that degree of profiting and this structure of the industry and trade is required for new innovation. But this is seriously contested, that it's not really funding innovation. Innovation occurs with public financing and it occurs all over, but they are able to buy up patents and secure a monopoly which to which their contribution is not as much. And we can pay for the financing of innovation separately from pricing and monopoly. So in this whole issue, there is this whole nature of international trade that is quite linked to this. That, I think, is the key issue. And therefore, the domination of the countries within which Big Pharma and the corporate world exists, and their interest as represented through their national representatives, does have quite a powerful influence. It's better contested in WHO, but yet the dominant influence is still on theirs.
Right. So much for the WHO's effort to sort of balance out the interests of big pharma and health equity and social justice. Now, what are the other items on the agenda this year's session, sir?
So one of the items relates to the what we're talking about now. The WHO is making a big pitch to raise its finances so that 50% of the finances at least come from the pooled finances that member states contribute or subscribe. And they are also created a WHO foundation which will raise funds. And this goes along with their approval of their next work plan. So this is important for WHO to be effective, and they are this figure of 15%. They hope will become 50%. It's going to be difficult to get through. The other important ones relate to universal health coverage, which I mentioned earlier, the different subsets. But there's also a very interesting one on climate change, which has and economics for all. There's a report on economics and health for all that has been placed and that's been brought to attention on that. So but I think that we need much greater engagement. If we have time, we should present on what is happening in universal health coverage and primary health centers. So way down in topic item 828, they have something which relates very much to primary health care and what is happening in the implementation of primary health care. So there is a number of other items, but each one will take its time to go through.
Right. One last question, sir, before I let you go. So, India, coming to India, basically, in this context, we are one of the world's largest health markets, and we are also a major supplier of generic medicines and, of course, vaccines. So, over a period of time, if you look at it, and also this year, how has India been able to utilize the World Health Assembly as a forum to push its own national interests and also, the generally speaking, the interests of health equity and health for all? What has been India's track record? If you can talk a little bit about that.
India's track record on the patent issue is fairly good. I think it needs to do much better. It has the credibility to actually get much more done. WHO can no longer ignore India and take a decision that does not suit India as a major decision, just as much as it cannot ignore the big power. So India has a lot of soft power and a lot of influence, which it to some extent mobilizes around patents, intellectual property rights, and drug manufacturing. But here now there is, as I said, we are also now a provider of drugs, but issues of generic drugs and their space and the limitations on exports that come from patent rights, India has been a good player there. But not good enough, but definitely one of the leading voices in the developing world. Their real weakness is that when it comes to strengthening public services, health services, universal health coverage, many of the other technical issues, India is not much of a player, not much of a leader. It's much more a passive follower of all that is happening. It much more tends to uh, take the lead from elsewhere and not have enough critical thinking on its own, which sort of the reason is like unlike Thailand, where Viroj is one of the key persons in the negotiation. India's performance in its own health system is one, not very heartening, not very encouraging, doesn't give it the uh, moral position to lead. But the bigger problem is that it is somewhat confused between on industrial policy and commerce policy, promoting the private sector in a very, very gung-ho sort of manner. And another side also trying to develop and keep a public health service for fulfilling some of its obligations on the health sector. So the broad trend has been that it has been a private commercial sector that has risen with very high out-of-pocket expenditures, very high problems of lack of regulation. One of the resolutions that has come before the WHO this time has not got enough attention is on organ transplantation. There, India is not in the lead as it should be, but much of the problems of what goes wrong in organ transplantation is a problem for India also. So I think that uh, global health diplomacy as an entire discipline and an area of thinking practice is weakly developed, and our own problems of putting universal health coverage on track is also been a reason why we do not occupy the level of leadership that we should have been occupying in WHO, except to some extent in the patents issue.
Right. I mean, India needs to really up its game in the global health diplomacy scene. And also, probably, I don't know, there is no reason why we are not at the forefront of universal health care. I mean, India, if there is any case for universal health care, universal, at least primary health care, India is it. And the fact that we have not taken this opportunity to take the lead, it's really puzzling. And hopefully, I think this will change in the years to come. Thank you so much, Professor Sundaraman. Unless you want to add anything on this a little further?
So, we must also look at which of the number of countries have a right to healthcare in place across the states or at the national level. India is one of the countries which really has to get started there. And that reflects rather than causes the problems that we are having in achieving universal health coverage.
Are there a lot of countries which have a right to health?
Yes, a lot of countries have. That has led to their achievement. Thailand, Brazil, even South Africa, but a number of other, Costa Rica, a number of, and in the high income countries, almost all, not necessarily called the Right to Health Act, but an act that ensures that services are guaranteed to all its citizens, like the National Health Services Act of the UK. So, the right to health and healthcare is sort of an understood thing and specific provisions for. India has yet to get started on that area. There's been some discussions, one or two state acts which are not yet, the rules have not been framed, have not been implemented. We are way behind. Therefore, to take leadership on the issue of the right to healthcare, which is what the WHO's core mandate is.
Right.
Is not going to be easy for you.
Right. Thank you so much, Arif. As you say, if countries like Costa Rica and Thailand and Brazil have a right to healthcare, and the entire high-income countries, the developed world, the Viksit world, so to speak, has a right to health. There's no reason why Viksit Bharat should not have a right to health as well. Thank you so much once again for coming on board and sharing your observations on the 77th World Health Assembly. It was quite enlightening to listen to you. Hope to have you back again soon. Thank you.
In Focus will be back soon with analysis of the biggest news issues. In the meantime, you can find our podcast on Spotify, Apple Podcasts, Stitcher, and other platforms. Just search for In Focus by The Hindu. We'll see you soon.